So we've checked the medical record for our order. And so we're gathering our necessary supplies. And what I don't have with me right now is the basin, but we can pretend this is a basin and washcloth to perform peri-care. I checked her chart for allergies. Doesn't show that she's allergic to anything. So I'm just going to come in and say, knock knock. My name's Tori Oxton, student nurse from LSC. Can I get your name and birthday? She's going to tell me her name and birthday. And I'm going to say, are you allergic to betadine or latex? She's going to say no. Or if she did, we'd find the appropriate non-latex things. If she had her head of the bed up, we're going to put her head of the bed down. I'm going to explain to her why we're doing this, which is because she hasn't gone to the restroom, can't void, and she has bladder distension. So she is supine, pulling this back. I'm going to reach over and grab my gloves, which are right here. I'm going to assist her into having her legs, abducted 2 feet apart, or at least in this position. While we're here, I'm going to look and do some assessments, see if there's any skin tissue breakdown, redness, signs of infection. We've assessed her bladder. It's distended, it's tender. I'm going to give her some patient education that this might be uncomfortable, and when I start inserting it, she's going to need to bear down, like she has to void, and to take some deep breaths as I start insertion. So, with our basin, both of these are Foley. We have our basin of warm water. I'm going to perform peri-care. We got a washcloth. Say this is our washcloth. And it's folded. So we've dipped it in our warm water. We go down one area, top to bottom. Get another corner. Top to bottom. Fourth corner. Middle, top to bottom. And we would do the same with another washcloth to rinse. Outside, outside, inside. And the same with the washcloth to dry. Outside, outside, inside. She is dry. I am going to take off these gloves for that. This has been opened before. I'm going to open this and pull this out. And this can be used as my trash bag receptacle. And we can have it between her legs if we want to, but if the patient moves, your sterile field is contaminated. This kit comes with sterile gloves, but I have already used this, so the sterile gloves aren't in there anymore. So we're going to open this away, 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 and away. Okay, I'm just going to get my sterile field kind of adjusted here. I'm going to move this over to our room. So, this is a drape that can go under her. She can lift her butt to help where that works. These would be the sterile gloves that are in there. They've been used, so clearly I'm not going to use these. They're just for packaging purposes. So now, I want to put on my sterile gloves. Since I'm not using this side to do any of my care, I can open my gloves. Glove on. Thumb doesn't want to cooperate with me today. Okay. So that's a whole lot of wrong. We can still go on here and get step away from here and get these gloves on. And I realized that I would most likely start with other gloves or restart with a different pair of gloves. But for purposes of supplies, we're going with it. So now I can take this fenestrated drape. It would go over the peri area or penis. I can reach in and grab this. It comes with betadine that we don't put on the mannequin. I opened the other one. Okay, cool. So this would go on there and we let that soak. And this is the lube we're not using for the mannequin. But with this one, I could just open this and dip the tip of the applicator into this. We're going to remove that. And so we can take this out, because both hands are sterile, remove this packaging. I'm going to make sure this clamp is all the way to closed here. I can put this all back in the box, or just keep it kind of like that. But since we can't use it, it's going here. Alright, so now this, my balls have been soaking with betadine. Both hands are sterile, but now I need to designate this one as dirty. I'm going to pull apart the labia, go down, other side, go down, other side, go down. At this point, I grab this with my sterile hands. My helper would spray this with mannequin lube. And yeah, you know what? We're going to have them sprayed. I thought we'd just go in for the sake of the video, but okay. So we need to go, please bear down like you're trying to void, and take deep breaths. So this is going in about 6 inches. We're going to say it's gone in about 2 more now. Okay, now both hands are dirty. I reach over here and insert her balloon. Now, if she was having pain, we would stop and pull it out and restart. So her balloon's inserted. Pull it back to meet resistance. Tape it onto her leg, which I don't have any tape. We could untangle this. Make sure the clamp is still closed, which it is. Hang this below the patient, but not touching the floor. And then we would clean up our mess, which I'll do right now because I want to gently fold this up and use it. Put the patient back in our correct position. And then we document how she tolerated the procedure, the amount that came out, the color of the urine, if we saw anything in the urine, and I believe that would be all. Thank you.